as a student long back, I first time understood the concept of hypertension while I was taking a bath. It was a rain shower bath, and suddenly the water stopped trickling down in the bathroom, and soapy and confused I stepped out. But at that time realized that how important it is to have the right kind of pressure while having a shower. Because if the pressure is too low, your body would not be perfused toward the water. And if the pressure is too high, you would feel uncomfortable while taking the shower. Similarly, the pressure in the blood vessel, blood pressure, we need in the right range. If the pressure is too low, that pressure is not good enough to perfuse the whole body. That's the hypotension side. And if the pressure is too high, that pressure is going to damage the endothelium lining of the blood vessel, can cause a lot of complications like atherosclerosis, and can cause end organ damage like in brain, kidney, retina. So that part is the hypertension. So we always need a normotension. We don't need too much high pressure or too much low pressure. Like while we're taking a bath in the rain shower, we don't expect that the water pressure is too high or too low. It just should be the perfect right, comfortable for us in that narrow optimal range. So now I'm going to talk about the renovascular hypertension, but let me first tell you a brief that we know that there are two kinds of blood pressure. One is systolic blood pressure and there is diastolic blood pressure. Systolic blood pressure is always higher because systolic blood pressure is the pressure is when the heart is contracting. That is systolic blood pressure. So obviously that would generate more pressure. When the heart is relaxing, we call it diastolic blood pressure, ventricles basically. So systolic blood pressure is always higher than diastolic blood pressure. And we know that different guidelines are there for the blood pressure. But now I'm basically focusing on the renovascular hypertension. Renovascular hypertension, to understand that, you need to understand that there are two forms of hypertension based on etiology. One is primary hypertension, where exact underlying cause is not known. There are a lot of hypotheses like genetic cause, improper handling of the sodium, which I have discussed in a separate session. That is called primary hypertension, which is 90 to 95% cases. But the other group is called secondary hypertension. Secondary hypertension basically means that there is an underlying cause which is well known. And there are basically four groups of key groups of secondary hypertension. One is called renal causes, which I'm going to discuss. Another is called endocrine causes. Endocrine causes like tumor from the adrenal medulla, pheochromocytoma can cause that. Conn syndrome can cause that. Cushing syndrome can cause hypertension. These are the endocrine causes. Then there are some cardiovascular causes like coarctation of aorta or polyarteritis nodosa, which is also a vasculitis. And then there are certain medications which can cause hypertension, like oral contraceptive pills with high estrogen, then erythropoietin, then certain immunosuppressants, they can cause hypertension. You understand? A lot of drugs are there which can cause hypertension. Corticosteroids are a very important one which can cause hypertension. So now I'm coming to the exact topic, which is the renovascular hypertension. Renovascular hypertension is the predominant cause of the secondary hypertension. And in all this renovascular hypertension, you'll be getting a recurring theme is coming. How exactly it happens, I'm going to explain step by step. So renovascular hypertension, what is the main problem? There will be some form of obstruction or decreased blood supply to the kidney. So kidney would sense that adequate blood supply is not occurring, and kidney would sense that the blood pressure is dropping, it would presume, because if the adequate pressure is not there, then it will not be adequately perfused, and then it will not be able to do its job, that is the urine production. So how kidney would react in such a scenario? Kidney would release renin from juxtaglomerular cells. Now renin would act on angiotensinogen, which is released from the liver. And angiotensinogen is called angiotensinogen because it causes genesis or formation or manufacturing of angiotensin 1. So renin would act on angiotensinogen to convert it into angiotensin 1. This angiotensin 1 would be again converted by endothelium with the angiotensin converting enzyme to angiotensin 2. Now angiotensin 2 has four roles. You all know these things. Firstly, they causes production of the aldosterone from the adrenal cortex, particularly from the zona glomerulosa of the adrenal cortex. And what exactly the aldosterone does? Aldosterone causes more sodium and water retention, when there is more sodium and water retention occurs, that would increase the blood volume. So more blood would come to the right side of the heart, more blood would go to the left side of the heart, and that would cause increase in the cardiac output. And we know all that blood pressure is basically dependent on cardiac output multiplied by peripheral resistance. These are the two key variables which are controlling the blood pressure. So if cardiac output increases, obviously blood pressure would increase. Now angiotensin 2 is also a very powerful vasoconstrictor. So it would also increase the peripheral resistance. So that is also another reason through this renin-angiotensin system blood pressure would be increased. Third thing, this angiotensin 2, they causes increased release of ADH from the posterior pituitary. When ADH is increased, what would happen? There will be more water retention that would again cause the hypertension in the same way by increasing the cardiac output. And angiotensin 2 can also cause increased thrust. So that would also cause increased load. So now you know that in any cases like renal artery stenosis, what is happening? That renal artery, there is a narrowing of the renal artery, could be due to atherosclerosis, could be due to fibromuscular dysplasia. As a result, what is happening? Renal artery is not giving adequate blood supply to the kidney. So kidney is reacting by releasing more renin. More renin is working on triggering this renin-angiotensin-aldosterone system. That means there is a more conversion of angiotensinogen to angiotensin 1. Angiotensin 1 gets converted to angiotensin 2, and then those four things happen. There is more aldosterone release, there is more cardiac output. Angiotensin 2 also acts as a powerful vasoconstrictor, more ADH release and thrust, which increases means more water intake would increase the body's fluid level also, and that would cause increase in the cardiac output. So these are the steps actually through which the renovascular hypertension occurs. I will take another example, that is polyarteritis nodosa. Polyarteritis nodosa, you know, there is typically a transmural necrotizing inflammation. It's a vasculitis. It's an inflammation of the blood vessel wall, which involves all layers of the blood vessel wall. That's why it's called transmural necrotizing inflammation. Transmural means, trans means through, mural means wall. Just like Crohn's disease, which is a separate disease which causes transmural inflammation of the GIT wall. But this is a blood vessel wall. That means tunica media, tunica intima, tunica adventitia. All the three layers of the blood vessel wall would be involved. And as a result, what is going to happen in this disorder? Inflammation also results in thrombus formation, thrombus formation. And ultimately, the blood vessel which is involved by the polyarteritis nodosa gets narrowed, including the renal blood vessel. So when the renal blood vessel would get narrowed, what would happen? Kidney would again not get adequate blood supply, and that would trigger the renin-angiotensin-aldosterone system, RAS. And that will also cause the high blood pressure in the same way. So these forms of hypertension where there is some form of obstruction or narrowing of the renal blood vessel, which is activating the renin-angiotensin-aldosterone system, that is called the renin-angiotensin system, that is called the renovascular hypertension. A typical example we know, which is renal artery stenosis, which simply means there is a narrowing or blockage of the renal artery. Most common cause is typically atherosclerosis, which is seen in elderly males more than 50. And younger females, you have to think about fibromuscular dysplasia. And there are some other rare causes like neurofibromatosis type 1 and all these things. So these are the points you need to know about the renovascular hypertension. And renovascular hypertension is always typically occurring due to excess release of renin, which is causing triggering of the renin-angiotensin-aldosterone system, and then it causes the high blood pressure, as I mentioned in this thing. This is the basic idea. I will continue on this topic in the future sessions also. Thank you so much.